Meeting to order. Would you stand and say the pledge of allegiance with us?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we're going to read our policy on the public comment. If there's anybody from the public that wants to make a comment to the board, they will need to go over to the table, that table over there, and read the script and then fill out the form to make a public comment. At the end, we will reserve about 30 minutes for public comments. But you will only get 3 minutes to speak on your topic. The board will not respond unless the chair allows it. Okay. Next up is a consent agenda. Oh, let me do roll. We've got Mr. Wickman, Mr. Jorgensen, and then Scott Belt and Susan Miller on the phone, correct?
Good morning.
Correct.
Okay, we got them all. Okay, consent agenda. Everybody read that over? Who wants to make a
motion to accept it.
okay? Need a second,
Second.
okay? All in favor, signify by saying aye.
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 Anyone opposed, same sign? Motion passes. Okay, we're here with some new hires today. So speak up, let's get introduced.
Candace Harris,
Hi, Candace.
pension officer
How long have you been with us, Candace?
today.
Sweet.
Yeah.
2 hours.
Yeah, a few hours now.
Tessa, I'll be in the medical department. I'm an RN.
Good.
Just started.
Well, welcome aboard.
Today as well?
Mhm.
You don't have to start every day with the supervisors meeting, just.
Now that'd get pretty boring for you. Well, good. Appreciate you bringing them up.
Yes,
Thank you. It's nice to do.
Who else we
Okay.
got?
Corporal Tony Rubeck, Programs and Training Division.
So you put them through their training?
Yes.
Good training on. Good.
Top of the line.
Sergeant Megan Leggett with the Training and Programs Unit as well.
Thanks for bringing them up. I really appreciate that. Okay, next up.
We're good.
That's all we needed.
Thank you, guys.
Thank
Pleasure
you.
meeting you. Have a lovely day.
Thanks.
welcome. Thanks for being here.
Thank you.
Thanks for your service.
3A is Jana Lemrick, Director of Human Resources, discussion and or decision on EAP, Employee Assistance Program Provider. Jana?
Good morning. We currently utilize CHI for our EAP services. You've probably seen that, Mitch. And we've used CHI for years. They've been wonderful partners. And EAP is a fantastic service that provides our employees and their dependents free counseling services for anything that they should need. The county pays for it. It's completely confidential and free to the employee. CHI, EAP, they see maybe 8 people a month. And we really kind of thought, with mental health is a big topic right now, especially mental health in the workplace. We as the county have experienced a few difficult things with some employees and realize the importance of mental health. And when it's time for us to discuss our benefit renewal, one of the big topics during our benefit meeting last week that Scott and I attended was mental health and the coverage for mental health. And so it's really something that we need to be thinking about. And we were putting some thought into, as we were changing occupational health providers, do we want to take a look at any other EAP providers, specifically any that are in Council Bluffs? Because the CHI location is in Omaha, and in fact, it was at Berkeley, moved Lakeside. So it is a drive for our employees, or if you live over here, it's a little bit of a drive. And we wanted to make sure that that wasn't any sort of hindrance. So we reached out so the only other place that does EAP is Best Care EAP, which is through Methodist. So it's not exactly through Jenny Ed, but it's through Methodist. But they do have a location here in Council Bluffs with counselors here in Council Bluffs. And so we felt, well, let's take a look at this because it's in our backyard.
Who would that be?
I don't know, I don't remember the exact location where the counselors are. That's a good question. I'm not exactly sure. And so we invited, CHI EAP and, Best Care EAP to come out and give us little presentations about their programs. And then the committee, which was community services, employees, public health employees, we sat and talked afterwards and then are coming to you with our recommendation to move our EAP services to Best Care EAP. The proposal that I provided to you is what Best Care provided to us. When CHI came, they didn't bring a proposal, they just talked. So I didn't have anything to provide to you from them. The reasons that we're recommending Best Care EAP is because of their location. We're hoping that employees will utilize it more because it's easier to get to. And then there are a few other services that are offered from this program. They have a very, very robust website. There's lots and lots of information on there, classes. It's a very robust program. With that robust program, though, would come a price change. And this is why I'm presenting it to you, the board, because this does come out of your budget. So currently, we bill based on our census, and so our last bill was for 494 employees. CHI charges us $19.42 per employee. And if you look at that page 6 of Best Care's presentation, they have a couple different price options based on what kind of package we would like. I just went ahead and calculated it at the $28.65 per employee for the 3 annual service hours. So that would be a difference to your budget of approximately $4,559. Now additional $4,559.62. So
How long is that price good for?
Oh, that's a good question.
Days.
Yeah, rates are guaranteed for 90 days from their proposal date. And I would imagine we would probably evaluate every year, similar to what we do with CHI EAP. But I can find out for sure, Scott.
Is
This
this in a contract form then?
Not yet. We would have a contract form, yes. And yes, Susan, this proposal was given to us earlier in 2024, but they are honoring the price today.
Okay, thanks, Jana.
Yep.
And how long
Jana,
is it good for?
I think we'll eventually go to probably that 24th Street location.
Oh, yeah, I'm not sure. Maybe
Yeah,
so. Yeah,
yeah, once it's built.
yeah, very possible. What did you say, Brian?
I see it's reflects a 1-year fixed rate agreement.
I could always ask them for a multi-year fixed rate agreement. I mean, it never hurts to ask.
What was the other number?
The one from CHI EAP that we use today?
No, you used the highest one from Methodist. What was it? It sounded like you had other numbers from them.
No, I used the lowest one from Methodist.
Oh, what was the highest?
The highest is $38.36 per employee.
Okay.
That provides 10 counseling sessions instead of 5, 6 annual service hours. And Scott, you do have this in an email, but you probably haven't seen it yet this morning. And then program options, 10.6. So it just gives you more options. And we can always, if we feel that we need additional things after we sign the contract, we can purchase things a la carte. So if we identify, something happens and we identify we need a different sort of class, or we need them to come on site for something, they'll just charge us separately if we need it.
But if
Yeah,
this is
thank
the way to
you.
go, I would say, let's do a year contract. And, you know, that 1 year, if we want to continue with multi-year.
Yep.
contract.
That hospital's supposed to be open like in the beginning of 26, correct?
I don't know when that's opening.
It was spring of 26, I thought.
Do you think that, do you think that location will be a stigma and our employees will be reluctant to go to the mental health hospital for
Well, I don't,
EAP assistance?
I guess I'd rather not, we don't know that that's where it's gonna be. We don't know that that's where they're gonna hold their sessions. So I guess I'm hesitant to answer that because I don't know. I'm gonna try to, look real fast at their locations.
That proposal is based on 550.
Yeah, at
employees.
that time, that would have been the census that we provided to them.
Well, that's not accurate. What is our accurate number?
Well, the last bill for CHI was for $494. So it fluctuates every month, but they would charge us quarterly, and so whatever it is at that time. So your cost could go up, it could go down based on the employee census.
So are we including part-time people?
Yes, all employees are eligible for EAP.
It still costs us $20 or $28
Mhm.
even for the, or do they prorate that for the time?
There's no proration.
What board members were on that committee, Jenna?
Brian was invited to attend, but he wasn't able to make it.
So no board members were there?
No, the people that were together felt that they could make a good recommendation. And this is that group's recommendation.
Who all was in that group?
Suzanne, Matt
Matt Wyatt?
Wyand, Allison Head, Maria Garfield. Yeah, and this came out of,
Were you in there, Mitch?
I wasn't. I did find the location. It's at Jenny Edmondson Hospital, 933 East Pierce Street.
okay. They probably have a clinic location. I can find out if they're going to move EAP, but I can't say for certain that they're gonna move it over to the new location. I don't know that all mental health services are moving over there or not. I can certainly find out. And this came about when we were talking about after, the situation that occurred, with the employee about, are we doing enough? What are we offering? What aren't we offering that we should be offering? And we really talked about getting together some trainings for management, frontline managers, supervisors, and then the employees themselves. But and then we talked about EAP as well. So this is a really good first start because they can also help us develop a curriculum, if that's what you want to call it, on what mental health training we might want to provide to our employees, such as recognizing when you have a peer who's in distress. What can you do about it? And then from a management standpoint, legally, what can we do? What should we do? What shouldn't we do when it comes to an employee and their private information? But we do want to do as much as we can to provide any sort of services or comfort.
Jana,
Yes, Scott?
this just covers employees only, right?
This is for employees and their families, but the cost is only per employee.
Okay, but so families have children that will definitely be going to that new facility down there.
Sure, but if they go through EAP, that would be different. You would get 5 sessions through EAP services, which right now we've identified is at the Jenny Ed location. And then if additional services are necessary, these counselors would help connect them with whatever else would need to come next. If there's another step or they need higher level, then I would imagine maybe they would go to that new location, but it would all depend on what the family chose.
that's focus is for the kids down there on 24th Street.
Correct.
Okay,
This would, go into effect July 1st.
Correct.
So you would give them a head count in June.
Mm-hmm,
That's what we would pay.
mm-hmm.
So if Brian uses his 3 service hours and Jeff doesn't need them, can Jeff give him his?
No. No. Now, EAP is not going to cut you off. If you've used your time and the counselor has determined you need a few more sessions, you can still go. They're not gonna leave you hanging. It's not gonna cost us anything extra. If throughout your sessions, they determine, you know what, you do need a higher level, or I probably should see you every week for a year, then that jumps to your personal insurance. So this is a great place to start.
Do we have a total number of employees that use this per year?
Per year, no, I have CHI's utilization report. This one is from September to November, and they had 9 people. 9 people use it.
September to November.
so
Um,
without actually having the contract and, having legal review the contract, I guess I'm not ready to I want to try to move forward with this thing, but I just gotta have a contract before
Well, and
Give
I
approval.
couldn't have a contract until I presented it to the board, since we are making a change and it is your dollars. I didn't want to
Right.
have a contract ready to go. So if you
I'm not-
give the okay to make the change, I can get a contract, have Kristen review it, and then Scott, as the chairman, you could sign it.
I would make a motion subject to the contract to move forward with them.
I would.
I guess I'd like to see the contract. I'd like to know what kind of reporting is available and
And I don't know
Well-
that that kind of details would be in the contract necessarily, Susan. Um, yeah, I mean, the contract's not necessarily gonna spell out the specific details of the reporting. On page, let's see. Page 3, it does list, let's see, I thought there was something about reporting. Yeah, HIPAA compliant quarterly reports on total impact and engagement. So it's very similar. Do you look at the ones from CHI?
I
It
don't
would
know
be
if I don't know if I've received those.
Okay, I know I I'm pretty sure they come to the board, but I'll double check. But it lets you know how many people attend. It might give you a reason why. It might say employee, spouse, or dependent, but that's it. That really would be the only information that you get to keep it as confidential. If it would be helpful, I could get an example of a report from Jenny Ed or Best Care.
An example of Jenny Ed's would be great, and then the last 2 reports from CHI would be really helpful.
Hey, Brian,
Yes,
I may not, I don't know if Kristen's there. I may not be able to make
Yes.
that motion.
It's fine.
she says she thinks it's fine.
Okay,
You
come
wanna
on in.
Do you want to wait until,
No, well, I stick with my motion. I mean, that means
Okay.
we're moving forward, but we have to approve the contract. Still,
okay, so your motion is to move ahead with this until she brings in the contract for us to review.
yeah, subject to us approving the contract.
Okay. You in agreement with that, Jeff?
I'm in total agreement.
Okay,
Janice, can you provide the information over the last couple of years, possibly how many employees use this?
Mhm.
And if you take, for $30 an employee, right?
Approximately, sure, yeah.
2865.
We'll want to make sure our head count is counted in June, not right now.
We'll.
Because of the part-time, that'd be a big deal.
Oh, sure, yeah.
Okay, I got a motion on the floor with the second. All in favor signify by saying aye.
Aye.
Those opposed, same sign. Motion carried. See you back here with the contract then.
Okay,
Thank you, Jana.
you're welcome.
All right, next up is committee appointments. Susan, you want to start?
Sure. I attended the What Should Be committee last Thursday. Good group moving forward. I'm anxious for our presentations. Attended the legislative coffee on Saturday morning, as did the entire board, which I think speaks volumes for the importance of the issues being discussed this legislative session. And I'm currently at the National Conference of Regions in Washington, D.C. at the guest of MAPA, and we are learning lots. So,
Good. Scott?
Well, I was at that coffee. I didn't learn a whole lot at that thing. And I'm out here at NARC also. It's pretty interesting, to say the least, that things are moving pretty darn fast at the federal level. So we'll see what the rest of the day brings and if we get out of here tomorrow. But hey, they shut down if they get a couple inches of snow here. That's the problem.
We're gonna get 5 to 6 inches tomorrow.
Well, shovel my driveway for me, will you?
I'll get right on it. When you come home, it'll be done. Not. Okay, is that it?
Yeah.
Tim, you got anything?
Nope.
Jeff?
I don't have anything but a question. Did we approve the minutes of the last meeting? We approved the
You know-
agenda, but that's something we needed.
Yeah, we did. You made the motion, Susan seconded it.
I thought I approved the agenda, the current agendas.
The consent agenda includes the minutes of February 4th.
Okay, let's see, we've done the board, then Los Hills Alliance, I attended that. Then the ATV River Valley with the state and conservation, I attended that. Then I was up to the ski hills. And then I was at the legislative coffee. And yesterday I was at the VA, so that was it. Okay, I think that's it on that. Next, we got the receive file. Any questions on that? Then the public comments. Anybody sign up? Didn't think so. Okay. So concludes our meeting. Now we have a budget study session.
In the live broadcast, Brian.
At this time, we'll end the live broadcast to go into budget study session.